For example, and I want you to practice here with me. So you want to write in the comment section your answer. I will be reading this question and we'll be discussing it together. But I want you to comment in the comment section your answer. That way I can see this basic, easy question. How are you answering? All right? Are you ready? Are you ready? Let's do it. Let's do it. A 24-year-old client with a recent diagnosis of type 1 diabetes presents to the basically the medical center with symptoms of increased thirst, frequent urination, and unexplained weight loss. Blood tests reveal a high blood glucose level of 280. The doctor prescribes a regimen of insulin therapy to manage the client's blood glucose level. What is the intended effect of insulin therapy in this client with hyperglycemia? So, although this is a rather easy question, it is important to understand some keywords that are in this question. It says, what is the intended effect of insulin therapy? The question is not about side effect. The question is not about adverse effect. The question is about intended effect. In other words, why am I giving insulin to a patient with hyperglycemia? What is your answer? To increase blood glucose level, to decrease blood glucose level, to regulate blood calcium level, or to stimulate protein synthesis. As I can see everybody answering on the chat, the answer is very easy. The reason why we give insulin to a patient with hyperglycemia is to help decrease blood glucose level. Very easy. Very easy. Now, do you expect to have a lot of questions like this on the NCLEX? No. This is basic content question. This is a recall and recognition, maybe understanding style of question. I see somebody commenting on the comment section about diabetes insipidus. Oh, be very careful. It is different. Diabetes mellitus and diabetes insipidus is completely different scenarios, different health problems. Okay, we will talk about that on a different occasion. I also see some of you selecting answer C, to regulate blood calcium level. The reason why we give insulin is not to regulate calcium levels, is to regulate blood glucose level. Remember that the pancreas releases insulin to help decrease blood glucose level when it's getting high. So you have to understand that. Now, let's go to a different style of questions. But before we get there, I want to train your brain. So let's warm up a little bit, okay? And I want you to help me do it. So let's warm up, and then I'll show you some interesting questions. So warm up.